Let's learn about the viscera of the duodenum and pancreas. So this is the viscera of the pancreas with duodenum. What are the anatomical points? The number 1, the head of the pancreas, it lies within the C-shaped concavity of the duodenum and is directed to the right. The tail of the pancreas is directed upward, backward and to the left, and the constricted neck is identified by the portal vein and it lies behind the neck. Now let's know what are the parts of the duodenum. We know there are 4 parts of the duodenum. The first part, then the second part, the vertical part, and the third part, the horizontal part, and the fourth part or ascending part. Now come to the pancreas. The pancreas has 4 parts: head, neck, body and tail. So this expanded part is the head. Then this constricted part, the constricted part is known as the neck. Then the body and the pointed part is known as the tail. So head, constricted neck, body and tail. Now let's come to the head. Head lies within the concavity of the C-shaped duodenum. It has 2 surfaces and 4 borders. So surfaces are the anterior surface and posterior surface, and there are 4 borders. This is the upper border, this is the right border, this is the lower border, and in some books it is written as left border is also present. So the head has 2 surfaces: anterior surface, posterior surface, and 4 borders: upper border, right border, and lower border, and some books it is written as left border also. Now come to the neck. First come to the uncinate process. So which one is the uncinate process? Look at that. The lower and to the left, the lower left extended portion of the head is known as the uncinate process. So this is the uncinate process. So a lower expanded portion of the head is known as the uncinate process. Now come to the neck. It's a constricted portion between the head and the body. So this is neck. So how you will identify the neck? You will identify the neck by seeing the portal vein. So let's see the portal vein. So look at that. This is the portal vein, and we know portal vein is formed by the superior mesenteric vein and splenic vein. So this is the splenic vein and this is the superior mesenteric vein, and this superior mesenteric vein and splenic vein, they together unite to form the portal vein. So this is portal vein, this is splenic vein, and this is superior mesenteric vein. So we will identify the neck by seeing in its posteriorly there is seeing the portal vein. Now come to the body. The body is triangular in shape. The cross section, it has 3 borders and 3 surfaces. So let's see the borders. This is the anterior border. Anteriorly there will be anterior border, inferiorly inferior border, and superiorly superior border. So superior border, anterior border, it is sharp, and the inferior border. So we can see there will be 3 surfaces. There will be anterior superior surface, anterior inferior surface, and posteriorly posterior surface. Or we can say this is the anterior surface or anterior superior surface, this is the anterior inferior surface or inferior surface, and posteriorly there will be posterior surface. And just posterior to the body of the pancreas, we saw that there is a splenic vein. So what is the posterior relation of the body of the pancreas? So there is the splenic vein, and in the upper border of the body of the pancreas there will be tortuous splenic artery, which is not present here. Now come to the tail. So tail is the most pointed part of the pancreas, and it is the most mobile part of the pancreas. It remains within the spleen, within the lino-renal ligament of the spleen. So this is the spleen. So within the hilum of the spleen it is attached by lino-renal ligament. Now let's know about the blood supply of the pancreas. The head and uncinate process, look at that, it is closely related to the duodenum, and we know the duodenum is supplied by the, actually second, third part and fourth part is supplied by the superior pancreaticoduodenal artery and inferior pancreaticoduodenal artery. So this portion of the pancreas will be supplied by the anastomotic vessels of the superior pancreaticoduodenal artery, which is coming from the celiac trunk, and as well as the inferior pancreaticoduodenal artery, which is coming from the superior mesenteric artery. And rest of the portion of the pancreas, that means body, tail and neck, this portion will be supplied by the tortuous splenic artery, and this tortuous splenic artery is coming from the celiac trunk. So that's the blood supply of the pancreas. So this is another viscera of the pancreas and duodenum, and we know in the just below the uncinate process there is superior mesenteric vessels. So let's see how does it look like. You can see there is the superior mesenteric artery and superior mesenteric vein. So the superior mesenteric vessels lies just behind the uncinate process, and one thing I want to show, we already told you that the second part, third part and fourth part of the duodenum, it contains some circular folds. This is known as the Pica Semicircularis. So let's see how does it look like. So this is the interior of the third and fourth part of the duodenum. You can see there are multiple circular folds within the duodenum. Okay, so these circular folds helps in the increasing of the absorptive area and helps in the absorption of the nutrients. So that's all about the pancreas and the duodenum. And one thing that is that cannot be shown here, but you have to remember about the pancreatic ducts. We know there are two pancreatic ducts, the major pancreatic duct or main pancreatic duct, and another one is the minor pancreatic duct. So the main pancreatic duct, it usually commences from the tail. So tail from the across the body it runs, and it receives small branches at the right angle, and it looks like a fish bone appearance. It is known as herringbone pattern. So the main pancreatic duct, it starts from the tail across the body, and along the course it receives some small ducts at the right angle. It is known as the herringbone pattern. Then it opens at the second part of the duodenum, and before opening it innerts with the common bile duct and forms a swelling which is known as the ampoule of the bladder, and ultimately open in the second part of the duodenum at the major duodenal papilla. And there is some accessory pancreatic duct. It is not present in everyone, it is present in only 10% population. So the accessory pancreatic duct, it also opens in the second part of the duodenum, but it lies about 2 cm above the major duodenal papilla. So the accessory pancreatic duct, if it is present, it is opened in the minor duodenal papilla of the second part of the duodenum, which is situated 2 cm above the major duodenal papilla. So you have to know about the duct system, you have to show the parts of the pancreas, and most importantly you have to show the relationship of the neck, that is the portal vein, how it is formed. That is formed by the superior mesenteric vein and splenic vein. So this is the splenic vein, this is the superior mesenteric vein, and ultimately together they form the portal vein. So that's all about this.